Question number 4 in the name of Deputy Keaveney.
Thank you, Concordia. Minister, we've seen a number of damning HIQA reports recently published that has highlighted that the government's serious failure with respect to disability services. Reports into St John of God's in Drumcar, Craig House in Sligo. Minister, are you concerned about these reports? And is it not evidence of the lack of political will at Cabinet with respect to providing for the best quality of services for people with disability in this country?
Thank you. Minister.
The Government is very committed to the protection and safety of our most vulnerable citizens and placed regulation and inspection of residential disability centres on a statutory footing in November 2013. Every person who uses disability services is entitled to expect and receive care of the highest standard and to live in dignity and safety. People with a disability should be able to maximise their potential and live rich and fulfilling lives. Compliance with the HIQA standards for disability residential centres is a requirement under the service level arrangements between the HSE and the voluntary service providers. 66% of designated centres for people with a disability were inspected by HIQA by the end of Q1 2015, including inspections triggered by complaints or allegations of mistreatment. The lessons learned from them are continuing to improve the quality of services. Clients and their families can be assured that this regulatory regime is being rolled out across all residential facilities for people with a disability. HIQA has reported evidence of very good practice in delivery of many residential services to people with disabilities, where the support and care of the needs of residents has been prioritised, and where there is a strong focus on the needs of service users. While HIQA's findings in some cases may make for very difficult reading, they serve as evidence that the regulatory process works effectively and in the interests of protecting vulnerable people in the care of the state. In this respect, for example, it's noted that HIQA's most recent report on Ars Attracta found very significant improvements in the lives of many residents. The Department of Health has requested the HSE to develop action plans to address cases where HIQA has raised serious concerns regarding the level of care of people with a disability are receiving in a number of disability centres, including safeguarding the human rights of residents. The HSE is implementing a comprehensive change programme of measures to improve the quality and safety of residential services for people with disabilities. Much work remains to be carried out on an ongoing basis to ensure all facilities comply with disability residential standards. While this programme will be challenging for the HSE, it's crucial in safeguarding vulnerable people in the care of the state.
Thank you.
I fail to see how the Minister is committed to the area of disability. The parliamentary question was not about the regulatory standards. It was about providing for resources for people with disability. Minister, are you not appalled at the Craig House report that found that as a consequence of the chronic staffing levels, staff resources, cuts to staffs, I quote, having a direct impact on the quality of life for residents? Minister, suppose in the week that the government have granted significant increases in the pensions of retired politicians, do you not find it appalling that you stand here today and say that you are committed to this sector when you have seen massive cuts to the disability sector, which has resulted in the slippage of standards? And these damning reports demonstrate your failure and the government's failure and highlighting the lack of political will to protect vulnerable people. Minister, do you intend to reverse those cuts approaching the next budget?
Look, of course I'm appalled at the negative reports that that are published about some disability centres, and often there are a number of issues as to why care is substandard. Resources are often only part of the picture. You'll have seen yourself that our extractor was very well staffed, in fact, but nonetheless there were major failings in care. I think it's worth pointing out two things. First of all, there were over 500 reports published in 2014 into residential centres. We've probably only heard about 6 or 7 of those, or maybe 10, because they were the bad ones. Let's not forget about the 490 or so that are very good, and the very good people who are providing an excellent standard of care there. And we should point out as well that before November 2013 there were no inspections. This sector was totally unregulated. I don't believe for a second that these problems did not exist during the 14 years in which your party was in office. But you didn't regulate the sector. You left it unregulated. You left people totally vulnerable, totally unprotected, and you didn't give a damn about them whatsoever. It's only since November 2013 that this sector is now regulated and it's properly inspected, and things are changing now, whereas for 14 years under your government, with massive funding available to you, you didn't even want to look inside those centres to know what was going on.
Deputy Keaveney.
Again, Minister, demonstrates that your unedifying response is a distraction from your commitment to provide for the most vulnerable people. If you were less focused on providing for the pensions of retired politicians and more enthusiastic about providing resources for people with disability, we wouldn't be standing here today asking this question. Can I ask, will you reverse the cuts that you strategically planned against people for disability? You were allegedly ahead of tax profile of €800 million. Is it on the back of cuts for disability services in this country that you approach that budget and tax profile?
Minister.
As is always the case, Minister Lynch and I will do our very best to make as strong a case as we can for all health and social care services, not just disability, but also for mental health, for the acute hospitals and for primary care. And of course, funding is limited, but you can be assured that we'll be making a strong case as we can to government to provide the additional resources that we need in the years to come.